Is my screen visible?
Yes.
Good evening to all. Thank you, Dr. Vinesh, for those very kind words. I'm not very sure if I deserve all those words, but thank you so much. It's always a pleasure to speak in this great forum, which is the brainchild of George sir and Dr. Vinesh. So today I'm going to speak to you all regarding dialysis water treatment. So we know that there are two sources of water that municipal water suppliers use. One is groundwater and the other is surface water. So groundwater comes from underground chambers such as wells, springs, and it's generally low in organic materials but higher in inorganic ions such as iron, calcium, magnesium, sulfate, etc. And surface water comes from lakes, ponds, rivers, and other surface-type reservoirs. It is generally more contaminated with organisms, microbes, industrial waste, fertilizers, pesticides, and sewage, etc. So the exposure to water, why is water treatment important? So a normal adult roughly consumes about 15 liters of water per week. Whereas if you look at a dialysis patient, dialysis patient uses about 400 to 600 liters of water per week. So water is considered as part of the prescription of the patient. We know that water makes about 90% of the solution used for dialysis, that is the dialysate. So what happens in water treatment areas can directly affect the patient and has the potential to harm many patients simultaneously if not done properly. Even tiny amounts of chemicals and contaminants in the water can be dangerous to the dialysis patient. Now, these are a few newspaper clippings to emphasize on the danger of not ensuring proper water treatment. On the left-hand side, you can see something which happened at the Edmonton Hospital, which came up in the news. A man died after using contaminated water for dialysis. And there was another series of deaths which happened in another hospital called the Hua Bin Hospital deaths. And recently in January, a series of patient issues happened at one of the NHS trusts. So here about 70% patients had a sudden drop of hemoglobin levels during dialysis. Their blood turned black and they had chest pain. This is a typical scenario of hemolysis which happens if the carbon tanks are not taken care of properly during dialysis. So whenever you see a problem in many patients in a shift during dialysis, the problem will usually be with the water or with the RO plant. So here we can see the signs and symptoms and possible water contaminant related causes of dialysis. So patients can present with anemia if there is a contamination with aluminum or chloramine, copper or zinc. Patients in the long term can have bone diseases if water is contaminated with fluorides and aluminum again. And hemolysis can happen if there is copper, nitrates or the presence of chloramine. Patients can have hypertension in the long run if water is contaminated with calcium or sodium. Hypotension can happen if there is bacteria in the dialysis fluid, if the endotoxin levels are high or if there are nitrates. Metabolic acidosis can occur in the presence of sulfates. There can be neurological deterioration if dialysis water is contaminated with aluminum in the long run. Nausea and vomiting can happen if there is bacteria, endotoxins, magnesium, nitrates, sulfates, zinc, etc. There can even be death if the levels of aluminum, fluoride are very high, if there are high endotoxin levels beyond the prescribed limit, if there are high content of bacteria in the dialysate. Here you can see the difference between permissible amounts of inorganic elements in drinking water and water used for dialysis. You can appreciate that the allowable limits are very stringent in water used for dialysis compared to water used for drinking. Conductivity is another thing which is very important. So conductivity is an indirect measurement of the total dissolved solids of water. Dialysis patients cannot afford to have a high conductivity water for dialysis. We will go a little into the history of RO. RO was used for dialysis water treatment beginning in the 1970s and 80s and became a gold standard by the 80s. During the 70s, there were multiple incidents of encephalopathy, anemia, and osteomalacia worldwide. The cause was identified as aluminum in the water system, basically. The problem was rectified when they used RO, and they also advocated heavy metal testing and adopted Army standards of water purity. Another incidence of chloramine poisoning occurred in 1980, where patients had hemolytic anemia due to inadequate chloramine removal. So we know that chloramines and fluorines are added in the municipality water in order to make water safe for drinking. So this issue of chloramine poisoning used to happen at multiple places in the USA during the 80s. And this was sorted after establishing dual carbon tanks and by real-time monitoring of free fluoride. Like I explained in my first slide, water obtained for dialysis is always from tap water, which is either sourced from the ground or surface water. So this has to undergo a series of processes before being usable for dialysis. For the purpose of understanding, let's classify this process to three stages: pre-treatment, a state of purification by RO, and water distribution system. Here you can visually appreciate the characteristics of water. So water, when you procure from the surface water or from groundwater, it is unsafe for dialysis. After undergoing a series of purification process, we have to make it suitable and safe for dialysis. The pre-treatment process in hemodialysis, about which I mentioned before. So the pre-treatment process is critical in protecting both patients as well as the dialysis equipment. The basic objectives are to remove chlorine, chloramines, remove hardness, ensure optimum pressures and temperature. So there are a few components that are responsible for pre-treatment, namely the blending valve, the booster pumps, the particle filters, softeners, carbon filters, and inline monitors and sampling tabs. Let's come to the first element called the blending valve. The blending valve mixes hot and cold water to an RO membrane and makes it at an industry standard temperature of about 77 degrees Fahrenheit or 25 degrees Celsius. Higher temperatures can damage the RO membrane, and lower temperatures will affect the water purity. So water temperature and flow are routinely monitored using an inline thermometer. A faulty blending valve could lead to temperature fluctuations, causing reduced RO efficiency, compromising water purity, resulting in ineffective chlorine or chloramine removal by the carbon filters, potentially causing hemolysis. A faulty blending valve can also result in bacterial proliferation, increasing endotoxin levels and patient risk due to inadequate purification by RO membrane. Next component is the booster pump. So municipal water supplies often have variable or insufficient pressure to about 20 to 50 psi. But for the RO system, we require higher pressures of 100 to 300 psi to force water through the semi-permeable membranes for purification. So RO members require a very narrow pressure range to operate efficiently. Too low pressure reduces the water flux, leading to inadequate water production, while excessive pressures can damage the membranes or cause leak. To ensure this, we have a booster pump in our water treatment system. The next element is called depth filter or the membrane filter. So incoming water often contains particles like sediments, silt, etc. And these can clog the downstream components like carbon filters, water softeners, RO membranes, etc. So when water flows through the filter media, particles are When water flows through the filter media, particles are physically trapped by this porous structure. So backwashing is necessary to flush out the trapped debris, restoring filtration capacity and preventing clogging. Pressure gauges are installed before and after the filter to measure the pressure differential, which indicates that the filter is working at the right condition. A low pressure indicates that the filter is clean and functioning well, whereas a high pressure signals particle buildup, indirectly telling us that backwashing or filter replacement may be necessary. Next component is water softener. So I mentioned about the blending valve. I told about the booster pump, the depth filter, and next is water softener. So hard water, we know, contains calcium and magnesium, and these hard water components like calcium and magnesium can form scales and mineral deposits on the RO membranes, and eventually it can foul the RO membrane. So once mineral deposits form on the RO membrane surface, the membrane performance and product water quality declines. So softeners, what do? They turn this hard water into soft water by removing calcium and magnesium and exchanging it for sodium. So the softener needs regeneration on a routine basis with concentrated sodium chloride solution or the brine solution before the resin capacity is used up. So monitoring is done using hardness test kits or strips to confirm effective hardness removal. The softener must have sufficient capacity to handle at least 1 day's water demand without exhausting its ion exchange resin, ensuring uninterrupted dialysis operations. And regeneration with brine has to be done on a regular basis. The next component is carbon filter. So carbon filters use granulated activated carbon to absorb contaminants like chloramines and free chlorine from water. And these are usually connected in series. So usually there are two tanks. One is called the worker tank. The second is called the polisher tank. But in most RO plants, they just keep one carbon tank, but it is always advisable to have two tanks. So these tanks contain activated carbon, which absorb molecules when that adhere to the surface. Chlorine and chloramines are not usually removed by RO, and they can damage the RO membranes. So these carbon tanks ensure that chlorine and chloramines are removed before water reaches the RO membrane. Monitoring of the carbon includes pre and post tank pressures, checking the display clock for the correct time, and testing the effluent for chlorine or chloramine breakthrough before each patient shift. Document when the carbon tanks have been exchanged or revetted and include the grade of carbon used and the length of the time the new carbon is rinsed on a daily basis. Now there is empty bed contact time. So each tank or pair of tanks should have an empty bed contact time for a total of 10 minutes. A 10-minute exposure time of water through the carbon tanks is necessary in order for the chlorine to be reduced to at least 0.5 milligrams per liter and chloramine to be reduced by at least 0.1 milligrams per liter. Exhausted carbon beds due to overuse or lack of replacement or insufficient empty bed contact time can allow chlorine and chloramine to pass through, harming patients and the RO membrane. So a good pre-filtration system, about which I described now, will extend the life of the RO membrane and increase the quality of the water produced. Now, the next component is the reverse osmosis system, the purification system. So the reverse osmosis system contains cartridge pre-filters, which you can see here in the image. These pre-filters are particulate filters positioned after all the pre-treatment components and immediately before the RO pump. So these filters range in pore size from about 1 to 5 microns. Two gauges monitor the inlet and the outlet pressures. The housing of the pre-filter has to be opaque to prevent growth of algae. Read and record the pre and post filter pressures and pressures daily. These pre-filters will regulate the amount of contaminants coming to the RO, thus prolonging the life of the RO membrane. The RO pump system. So the RO pump system is the noisy thing you hear in the RO room. So this RO pump increases water pressure across the RO membrane to make pure water. The RO systems typically operate between 200 to 250 pounds pressure. So RO pumps are made of high-grade stainless steel, and these are inert plastics or carbon graphite fetted parts. Monitor the inlet and discharge pressures on a regular basis and record this daily. The RO membrane. So the RO membrane is the heart of the RO system. So it produces purified water through reverse osmosis. So we know osmosis is a naturally occurring phenomenon involving flow of water from a less concentrated compartment to a more concentrated compartment across the semi-permeable membrane until the equilibrium is reached. In reverse osmosis, the exact opposite thing happens. So concentrated water is forced to flow in the opposite direction or in an unnatural direction across the semi-permeable membrane by means of high pressures. The component after the RO is called the deionizer. So after RO, water is nearly pure but may still contain trace ions that could harm dialysis patients or affect dialysis equipment. So the deionizer unit, also called the polishing deionizer, removes these residual ions. These ions can be cations or anions. And the DA unit contains two types of exchange resins. One is a cation exchange resin, and the other is an anion exchange resin. So when these exchange resins are exhausted, there can be increase in bacterial and endotoxin levels, risking patient toxicity. It can result in hemolysis or inflammation. Monitoring with mandatory inline resistivity monitors with alarms detects ion breakthrough in real time. Now, so we spoke about the pre-treatment, we spoke about the reverse osmosis. Now we are going to speak about the water distribution system. The water distribution system consists of the storage tanks, the UV irradiator, submicron and ultrafiltration system, and the piping. So, speaking about the loop system, the dialysis loop system, it is the tubing that feeds each dialysis machine. So you can see it here. It feeds each dialysis machine, and its goal is to feed every machine consistently by maintaining the bacteriological quality. So we should make sure that the loop system should have no dead ends. It is better that after the storage tank, we should not make any provision where water can remain stagnant. The loop system has to be made of inert materials, and these materials should be compatible with the disinfection methods used. So the feeding of a loop is divided into two categories, that is the direct and indirect feed. So direct feed delivers the product water from the RO unit to the loop for distribution, and then water comes back to the RO. In the indirect feed, it involves a storage tank, and the storage tank should be conical in shape so that when we empty the storage tank, water is emptied completely and there is no stagnant water anywhere. This is the same thing which I mentioned. So there should not be any dead ends or multiple branches in the distribution system, because these can harbor bacterial growth. It can also lead to bacterial biofilm formation. To minimize biofilm formation, we should always ensure that there should be flow in the piping. Water should never remain stagnant. So this is the water storage tank and the recirculation pump. Water storage tank should have the following characteristics. Like I mentioned, it should have a conical bottom. So the storage tank here actually has a conical bottom. What you see here, the blue thing is just a stand. So this conical bottom ensures that water is completely emptied. And then there should be a recirculation pump to circulate water through the distribution loop. There should be alarm switches to control the RO unit and the recirculation pump. There should be a bacteria filter on the tank overflow. Monitoring of bacteria and endotoxin is recommended after the storage tank, and the airman filter should be replaced routinely. Pre and post pump pressures should be recorded daily. After the RO and the deionizer comes the UV irradiator. So it's a low pressure mercury vapor lamp enclosed in a quartz sleeve. It emits a germicidal dose of radiant energy to kill bacteria. It's possible that some species of bacteria can become resistant to UV irradiation. UV does not destroy endotoxins. So, and it may even increase endotoxin because of when UV irradiation is done, bacteria can die and they can release endotoxins, especially the gram-negative bacteria. So UV should always be followed by an ultrafilter. The biofilm also reduces effectiveness of UV. So next comes the submicron and the ultrafiltration filter. Submicron filter reduces the level of bacteria in the final product water. Ultrafilter removes both bacteria and endotoxins. Both the membrane filters that can be cross-flow types with a feed stream and reject stream, or a dead-ended design with one stream. So these are just, don't worry about it, these are just different types of designs. Ultrafilters have tighter pores, low flows, high delta pressures. They decrease flow velocity. All submicron and ultrafilters should be changed on a monthly basis. So this is an image of the UV filter and the micron filter. Now the other thing what is very important is the disinfection of the distribution piping system, or what we call loop disinfection. So loop disinfection can be done by two methods. One is chemical disinfection, one is hot water disinfection. So what we mostly follow in our dialysis units are chemical disinfection. We use hypochlorite solution, which is bleach, or aqueous formaldehyde solution. Some centers use hydrogen peroxide, peroxyacetic acid, glutaraldehyde, ozone, etc. So the other method is called hot water disinfection. So this is the currently preferred method, which is hot water disinfection. So hot water is delivered at a high temperature and exposure time, which is specified by the manufacturer. So minimum distribution loop temperature is about 60 degrees Celsius. So usually in our dialysis units, mostly we use PVC pipes. So these PVC pipes are usually medical grade PVC pipes, which are inert to chemical disinfection methods like bleach or formalin. But PVC pipe cannot be used if you're planning on using hot water disinfection. So this hot water disinfection is different from the heat disinfection which you put in the dialysis machine. So if at all you're planning to do hot water disinfection, instead of PVC pipes, stainless steel pipes are the preferred modalities. You might have heard about biofilm. So what is biofilm? So biofilm is a structured microbial community in slime, endopolysaccharides, and these adhere to pipe and tank surfaces. So this is an ultrastructural image of biofilm formation obtained by scanning electron microscopy. So why does it matter? So biofilms are reservoirs of bacteria and endotoxins, and it can enter the bloodstream. These biofilms are usually very resistant to disinfection, and they grow very rapidly. Conditions favoring biofilm formation are warmer temperatures, stagnant or slow flow areas, nutrient traces in water. How can you prevent this? Using ring piping, using smooth materials, adopting hot water disinfection, and even chemical disinfection. Regular monitoring for biofilm is essential. Once mature, biofilm is almost impossible to eradicate, so prevention is critical. So you might find when you send water for colony to look at the colony counts and to look at the endotoxin levels, the water sample taken after the storage tank might be okay, but the water sample which you take from one of the foods might be contaminated with some coliform, or there might be some endotoxin levels. So this always happens because of biofilm formation in the loops. So biofilms mostly can be eradicated by disinfection methods when you use loop disinfection, but sometimes these can be very resistant, and even after multiple disinfection methods, if still these remain, you will have to ultimately change the piping, the entire piping. The microbiological standards determined provided by various agencies. So the AMI standards is what we usually follow. They prescribe no more than 200 colony forming units per ml of microbial contamination, and they suggest that bacterial endotoxin levels should be less than 2 endotoxin units per ml. The European Pharmacopoeia has stricter guidelines. They say that microbial contamination should not be more than 100 colony forming units per ml, and bacterial endotoxin levels should be suppressed to less than 0.25 endotoxin units per ml. Now, there is something called ultra pure water. The ultra pure water is important, especially in hemodiafiltration, where you have to produce online replacement fluid as well during dialysis, during diafiltration, and then this replacement fluid is supposed to be infused to the patient. So here, water purity is of utmost importance. So what is prescribed is ultra pure water. Ultra pure water should not have a colony forming unit count of more than 0.1, and bacterial enterotoxin levels should be less than 0.03. There are certain quality testing guidelines recommended by ARMI and the ISO. So conductivity should be monitored continuously in the RO plant. Conductivity should ideally be less than or equal to 0.3 microsieverts per centimeter. TDS is, like I mentioned, total dissolved solids, which is an indirect measurement of the conductivity. Chlorine levels should be measured daily. Ideally should be measured in every shift, and it should be less than 0.1 milligrams per liter. So to check chloramine levels, kits are available. Endotoxins should be checked every month. It should be less than 0.25 as per the ISO ARMI standards. And bacteria level should be less than 100 colony forming units as per the ISO standards. As per the ARMI standards, endotoxin level is the cutoff is less than 2, and the colony forming unit cutoff is less than 200. But as per ISO and European Pharmacopoeia, it is less than 0.25 and less than 100. Chemical analysis should be done for all these inorganic elements like aluminum, copper, lead, and it should be done every 6 months. Hardness and chloride levels should be checked ideally weekly. Now, if these things are taken care of, when these things are taken care of, it extends the life of our dialysis patients, and it also prevents untoward incidents, like a few incidents which I mentioned in my earlier slides, which happened in hospitals worldwide and might have happened in our centers too. So I come to the end of my presentation.